What really happens to your body when you start taking omega-3 for 30 days? Have you ever wondered what truly happens inside your body when you start taking omega-3 fatty acids consistently for 30 days? Or what effect increasing your intake of fatty fish might have on your health? It may seem like a small dietary tweak, but omega-3s are one of the most potent nutrients for human health, and their impact is anything but minor. In today's video, we'll take a deep dive into the top 7 science-backed benefits of omega-3s, whether they can help or harm people with fatty liver disease, the best time of day to take them for maximum absorption, and the hidden risks of omega-3 supplements that most people overlook. Plus, we'll guide you on how to choose the right omega-3 supplement, how many capsules you might actually need, and whether it's better to eat foods like sardines or take fish oil capsules. Some of the answers may surprise you. But before we begin, show your support by liking this video, subscribing to our channel, and hitting the bell icon so you never miss our expert health updates. And don't forget to share this information with friends or loved ones, because when it comes to wellness, sharing is truly caring. Now, let's begin with the most fundamental question. Are you getting enough omega-3 in your diet? Omega-3 is an essential fatty acid, meaning your body cannot produce it on its own. You must get it from food or supplements. There are 3 main types. ALA, alpha-linolenic acid, found in plant sources like flax seeds, chia seeds, walnuts, pumpkin seeds, Brussels sprouts, and spinach. EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, found primarily in animal-based sources like oily fish, salmon, sardines, mackerel, trout, tuna, and anchovies, and pasture-raised eggs. While ALA can be converted into EPA and DHA in the body, this conversion is highly inefficient in most people. That's why directly consuming EPA and DHA from fish or supplements is far more reliable. Here's a crucial point most people overlook. Over 70% of the global population is deficient in omega-3s. At the same time, we're consuming excessive amounts of omega-6, found in vegetable oils like soybean, corn, and sunflower oil, and even in the meat of grain-fed animals. Omega-6 is pro-inflammatory, while omega-3 is anti-inflammatory. The optimal ratio between them used to be 1:1. Today, in modern diets, it can be as high as 20:1, creating a chronic inflammatory environment in the body. This imbalance can lead to joint pain and stiffness, chronic fatigue, skin problems like acne or eczema, digestive disorders, hormonal imbalances, cardiovascular strain. Correcting this ratio by increasing omega-3 intake has been shown to dramatically reduce systemic inflammation and improve overall health, especially in older adults. But before we continue, tell us in the comments, have you tried omega-3 supplements before? Do you notice a difference when you include more fish in your meals? And where in the world are you watching from today? We love hearing from you, and your experiences could help inspire someone else's. Top 7 health benefits of omega-3, backed by research. 1. Omega-3 and heart health, reducing cardiovascular risk naturally. Omega-3 is perhaps best known for its powerful cardioprotective effects. These fatty acids influence multiple key factors related to heart disease, including lowering blood pressure, reducing elevated triglycerides, raising HDL, good cholesterol, suppressing inflammation in blood vessels. Together, these mechanisms significantly reduce the overall risk of cardiovascular disease, which remains the leading cause of death globally. However, not all omega-3 sources are created equal. Scientific evidence consistently shows that people who consume fish rich in omega-3, such as sardines, mackerel, and salmon, at least twice a week, have a lower risk of heart attack and stroke. But when it comes to omega-3 supplements, the data is mixed. Here's what the research tells us. Not all fish oil supplements offer the same benefits as whole food sources. Only pharmaceutical-grade, high EPA formulations, such as prescription products like icosapent ethyl, Vasipa, or Epinova, have shown significant benefits, including a 25% reduction in major cardiovascular events, according to the REDUCE-IT study. These potent formulations are available by prescription only in the United States and are not found in standard over-the-counter fish oil products. 2. Omega-3 and skin health, nurturing radiance from within. Omega-3 fatty acids play a significant role in supporting skin health, and their benefits go far beyond surface-level beauty. These essential fats interact with what researchers call the gut-skin axis, a communication pathway between your digestive system and your skin. When your gut microbiome is healthy, your skin often reflects that balance through improved texture, hydration, and resilience. By enriching the gut with anti-inflammatory and microbiome-supporting nutrients, Omega-3 helps promote the growth of beneficial gut bacteria. This, in turn, reduces systemic inflammation, which often appears on the skin as redness, acne, or flare-ups. Improves skin hydration and elasticity, making skin feel and appear more smooth. Balances sebum, oil, production, which helps lower the risk of clogged pores and breakouts. Fights signs of premature aging, such as fine lines and dullness, by supporting collagen structure and reducing oxidative stress. Clinical studies have also shown that omega-3 fatty acids can soothe inflammatory skin conditions such as eczema, psoriasis, and dermatitis. This makes them not only valuable for aesthetics, but also essential for individuals dealing with chronic skin irritations or sensitivity. Incorporating omega-3 into your daily routine, whether through diet or supplementation, is a holistic and science-backed strategy for achieving healthy, youthful-looking skin from the inside out. 3. Omega-3 helps lower high blood pressure. High blood pressure, hypertension, affects nearly 1 in 2 adults, often silently damaging arteries, kidneys, and the heart. Omega-3s help to relax blood vessels, improve arterial elasticity, and reduce vascular inflammation, leading to more stable blood pressure. Here's how Omega-3 contributes to better cardiovascular regulation. Promotes nitric oxide production, a compound that widens blood vessels. Reduces arterial stiffness, a common problem as people age. Lowers systemic inflammation, which is often elevated in those with hypertension. People who follow Mediterranean or DASH diets, both rich in omega-3 rich fish, show a notably lower incidence of hypertension and heart disease. Fish oil supplements have also been proven effective, especially in individuals with moderate to severe high blood pressure. However, for those with advanced hypertension or heart disease, omega-3s should be seen as complementary, not a replacement for prescribed medications. Always consult your doctor before adjusting your treatment plan. 4. Omega-3 provides natural inflammation relief for joints. One of omega-3's most well-documented benefits is its ability to fight chronic inflammation, a root cause of many modern health issues, especially joint pain and autoimmune diseases. EPA, the anti-inflammatory component of omega-3, works by blocking inflammatory molecules such as prostaglandins and leukotrienes. In individuals suffering from rheumatoid arthritis or osteoarthritis, omega-3s have been shown to reduce morning stiffness, lower joint tenderness and swelling, improve grip strength and physical function. A major study in the American Journal of Clinical Nutrition found that regular intake of omega-3 supplements reduced the need for nonsteroidal anti-inflammatory drugs, NSAIDs, which can have long-term side effects on the kidneys, liver, and stomach. For anyone over 50 with stiffness, aching joints, or autoimmune flare-ups, omega-3s offer a safe and natural alternative to chronic pain medications. 5. Omega-3 helps reduce triglycerides and supports heart health. If you've been told your triglyceride levels are elevated, adding more omega-3s to your diet may be one of the most natural and effective solutions. Triglycerides are a type of fat found in the blood, and high levels are linked to an increased risk of atherosclerosis, hardening of arteries, heart attacks and strokes, pancreatitis, a potentially dangerous inflammation of the pancreas. Omega-3s, particularly EPA, work by lowering the liver's production of triglycerides, increasing the clearance of triglycerides from the bloodstream, raising HDL, good cholesterol, which helps remove excess fats from the blood. Sources such as chia seeds, flax seeds, walnuts, and fatty fish like mackerel and salmon, or high-quality fish oil supplements, can lead to a 20% to 50% reduction in triglyceride levels, depending on the dose and individual health status. Additionally, omega-3s may improve liver fat metabolism, making them beneficial for people with non-alcoholic fatty liver disease, NAFLD, a condition increasingly common among adults over 40. 6. Omega-3 enhances brain function, memory, and emotional stability. Omega-3 fatty acids, particularly DHA, docosahexaenoic acid, are critical for the structure and performance of the brain, which is composed of nearly 60% fat. DHA, a major structural component of brain cell membranes, plays an essential role in neural signaling, memory retention, and mental clarity. In recent decades, as omega-6 consumption has skyrocketed due to processed foods and vegetable oils, so have rates of depression, anxiety, and cognitive disorders. This correlation is not coincidental. A balanced omega-3 to omega-6 ratio is vital for mental well-being. Regular intake of omega-3s has been shown to improve neurotransmitter communication, especially in memory-related areas of the brain, support neuroplasticity, which is the brain's ability to adapt and form new connections, essential for learning and memory, reduce oxidative stress and lower inflammation in the brain, protecting neurons from degeneration, alleviate symptoms of depression, anxiety, and even ADHD and bipolar disorder, thanks to its mood-stabilizing and anti-inflammatory effects. A comprehensive review of clinical studies published in Frontiers in Aging Neuroscience found that individuals who consumed higher levels of omega-3s had significantly better memory recall, emotional resilience, and cognitive performance, especially in older adults at risk of dementia. In short, omega-3 is not just a supplement. It's neuronutrition that supports everything from emotional balance to sharp thinking well into old age. 7. Improved eye health and protection against vision loss. Omega-3s, particularly DHA, are major structural components of the retina. They help preserve the integrity of vision and may significantly reduce the risk of macular degeneration, one of the leading causes of age-related blindness. In one large-scale study, people with high omega-3 intake had up to a 30% lower risk of developing macular degeneration. Omega-3s also help lower intraocular pressure, reducing the risk of glaucoma. And for those suffering from dry eye syndrome, omega-3 supplementation has shown to reduce symptoms by over 77%, improving tear production and reducing irritation. A growing body of research suggests that dietary sources of omega-3, such as sardines, may offer more comprehensive and synergistic health benefits than supplements alone. A recent study published in Frontiers in Nutrition by researchers from the Federal University of Uberlandia and the University of Sao Paulo found that eating sardines 1 to 2 times per week significantly improved cardiac markers and hemodynamics. Why? Because sardines are not only rich in omega-3 but also contain calcium, potassium, magnesium, zinc, iron, taurine, and arginine, which support heart rhythm and vascular health. These nutrients work together to optimize heart performance, something that capsules often can't replicate. While omega-3 supplements are beneficial for many, they are not without risks, especially when misused or taken in excess. Some known side effects and complications include increased risk of arrhythmias, particularly atrial fibrillation, which is associated with higher risks of stroke and cognitive decline. Interactions with medications, especially anticoagulants and antiplatelet drugs, increasing the risk of bleeding. Reduced effectiveness of birth control pills. Gastrointestinal side effects such as bad breath, burping, a fishy aftertaste, acid reflux, nausea, diarrhea, and skin irritation. That's why it's essential to choose high-quality supplements and consult with a healthcare provider before starting any new omega-3 regimen. If you opt to take omega-3 capsules, here are 3 essential tips to ensure you're getting the most benefit. 1. Check the packaging. Choose supplements in dark, opaque bottles that shield the oil from light. Fish oil is highly sensitive to light and oxygen, which can cause it to oxidize, turning it rancid and potentially pro-inflammatory. 2. Examine the expiration date. The farther from expiration, the better. Exposure to light, air, and time degrade omega-3s. Rancid oil smells fishy and can cause digestive distress while doing more harm than good. 3. Analyze the EPA and DHA content. Don't just check total fish oil content. Look for the combined total of EPA and DHA. For effectiveness, aim for at least 1,000 milligrams, 1 gram, of EPA plus DHA daily. Some capsules may only provide 300 to 500 milligrams per pill, requiring multiple capsules to reach the effective dose. Types of omega-3 supplements. Fish oil, affordable and widely available. Check for purity certifications. Krill oil, more stable and bioavailable. Naturally contains antioxidants like astaxanthin. Algae oil, plant-based and sustainable. Ideal for vegetarians and vegans. To improve absorption and reduce side effects, take your Omega-3 supplement. With meals, preferably breakfast or lunch, as dietary fat helps enhance uptake. Avoid taking on an empty stomach, which can lead to reflux or a fishy aftertaste. Also, avoid buying in bulk quantities lasting longer than 3 months, as the risk of spoilage increases over time. Omega-3 is one of the most versatile and scientifically validated nutrients for long-term health, supporting the heart, brain, skin, joints, and gut. But it's not a one-size-fits-all solution. Whether you're choosing food sources or supplements, understanding how it works, what dose to take, and potential interactions is essential. If this video helped you better understand Omega-3, consider liking, subscribing, and sharing it with friends or family. Your health journey could inspire someone else's. And we'd love to hear from you. Do you take Omega-3 supplements, or do you prefer fish? Have you noticed any changes in your health? Drop your thoughts in the comments. We reply to everyone. Stay healthy, stay informed. Thank you for watching, and we'll see you in the next video.